Hello, I'm Dr. 𝐒𝐇𝐀𝐓, working as a trainee at the Department of Anesthesia, ICU and Pain Medicine, and today I'm going to discuss about shock, which is a must-learn topic for all of us, especially the health workers, health professionals, trainees, doctors who are working at different level of hospitals, ICU or somewhere else. It's really a must-learn topic for all of them. So let's start by the definition. What is shock? Shock is a systemic state of low tissue perfusion which is inadequate for normal cellular respiration with insufficient delivery of oxygen and glucose. So let's go with the features. What are the features of shock? At first, it will be hyperkalemia. That means potassium is in your blood. Due to hypoxia or hypovolemia, failure of sodium-potassium pump occurs, and also intracellular lysosome release autodigestive enzymes, and cell lysis occurs that release intracellular potassium out of the cell that will increase their concentration in your blood. That is how it causes hyperkalemia. Then hypoxia and ischemia. Due to low blood supply, hypoxia occurs and it leads to generate free radicals and activate complement system. Then it will be metabolic acidosis. Due to hypoxia, anaerobic glycolysis stops and anaerobic glycolysis starts. Aerobic glycolysis stops due to hypoxia and anaerobic glycolysis starts. And pyruvate lactate is the end product of anaerobic glycolysis that will increase lactic acid concentration in your blood and causes acidosis. Then respiratory alkalosis. Due to metabolic acidosis, increased sympathetic response results in an increased respiratory rate causing respiratory alkalosis. The most important feature is tachycardia. Due to hypovolemia, preload and afterload decrease, there is compensatory baroreceptor response, increased sympathetic activity and release of catecholamines into circulation, resulting tachycardia, tachypnea, and vasoconstriction. Then vasoconstriction is one of the most important features regarding shock, except septic shock. In case of septic shock, it causes vasodilation. That is exceptional. And the other feature is decreased urinary output. Decreased perfusion pressure due to low blood pressure or kidney leads to reduced filtration at the glomerulus and decreased urinary output. That also decreased GFR. And due to decreased urinary output, it activated renin-angiotensin-aldosterone mechanism, and it causes activate further vasoconstriction and increase sodium and water reabsorption. This will increase blood pressure and urinary output as a result of compensatory mechanism. Then anaerobic glycolysis. As I told you earlier, hypoxia leads to anaerobic glycolysis. When there's decreased the blood concentration of oxygen, tissue causes activation of anaerobic glycolysis for production of ATP. Then cold clammy skin. Due to vasoconstriction, it will cause cold and clammy skin. And one of the most important parameter regarding shock is to maintain the urinary output. So that's all from today, because we are discussing about the features of shock, and on the next video we will discuss about the types of shock.